Kelly with my friend Kanisha Brown. Yes.
Hi.
And she is a RN, a registered nurse, and I'm going to ask her a few questions about her career. So, do you know what type of medicines you use in your career, like taking care of the patients?
It really depends on what their care team prescribes them. Basically, everything revolves around the patient. It's called holistic care. Mainly, it's more than just caring for them physically. You got to be there spiritually, emotionally, you know. And if something's changed, it can cause the atmosphere for that patient's care to decline. Like if there's abuse or anything like that, that can cause a decline in care. If something's going on within the care team that gets outside of the care team, there's a breach of privacy, implied.
Your mom's looking for you.
And everything like that.
Okay, sorry. For your procedures, what do you do for safety procedures? Do you have any or before?
Yes.
Okay.
Everything is safety. There's OSHA that we have to follow through with. So basically, when it comes to the privacy of the patient, you have to first knock because you have to announce who you are. You can't just go in without notifying that you're at the door. Because some patients, they might have dementia and don't remember you from the day before. So you always have to identify yourself before you go into the room. And then you have to always wash your hands before you do or touch anything. Because everything can be transferable to anything that you touch. And then, like if they need a bed bath, there's a procedure with that. You have to, it's a big rundown. You have to wash your hands. You have to undress the patient, make sure they're covered up for privacy, even if they're in their own room. Because some might be a little shy, or they, may not be aware of what's going on. Because some patients might be in comas, some might be paralyzed, or some are just out of it. So you always have to protect them in any type of way. And then there's with instruments that you use, like gloves. You have to always change your gloves. Some people don't change their gloves, which is sad to say, but that's the main thing. When you, like if there's a needle, you never recount a needle. That's why they have the retractable ones that when you, after you use them, you push a button, it goes, and then you put it in the sharps container. But there's always things you have to look for because you don't know if you prick your finger on the needle, what if the patient has HIV or AIDS and you don't know if you're not part of the care team. You know what I'm saying? So it's always best to pay attention to things when you're doing everything. The littlest thing can mess up everything.
Do you have any safety drills like fire safety or in case?
That really depends on the facility that you're in. Like if there's a fire, most rooms have like an automatic lock on the door. It'll close on its own and then it'll lock. Like nobody can get in or out. To me, it's a little excessive because if they're on oxygen or anything like that, everything basically is shut down. It just really depends on the facility. But you have to get the patient first.
Oh.
You can't. That's when a time when everything's frantic, but you have to still care about the patient. Get them first. Worry about yourself later.
Okay. Do you have any special equipment that you use to take care of them?
Like some people who can't stand on their own, we use sit stands. Basically, it's like a small Hoyer lift. So you put a gait belt around them, and then it's a little small machine. You put them in front of them, they put their legs on it, and then it's a little button or a little lever that you push, and it's up basically, and it'll lift them so that they can stand, or you can give them a partial bath or change their briefs if they're incontinent. Then there's the Hoyer lift. If they're like bedridden, they can't move at all. You have to put it's a little bed, it's like a little sheet or a little mat you put under them. Then you have to make sure the straps are between the legs so they won't fall forward, and make sure it's supporting their upper back. And then you put it on, it's a little crane basically. And it can go up to probably 6 feet in the air, and it'll lift them up and put them in a wheelchair or a little geriatric chair for them to go where they need to go. So those are some of the little instruments that we use.
Is there any schooling or education that is necessary for this job?
Yes. I started off with going to UPMC Senior Communities. They have free CNA classes. That's where I started. So you can go there, get the fundamentals, and you can also, while you train, you also work with the patients as well, so you get hands-on learning. And then you can choose to just stay there and get your certification for nursing assistant, or you can advance higher to LPNs, RNs, physician, whatever you want to go. But that's generally where you would start.
Oh, thank you for your time.
Oh, no problem. Anytime for you, Marjorie.